The primary goal of Burke Rehabilitation Hospital is to help patients achieve their medical stability and their highest functional level possible. Our goal is to help the patients become as independent as possible, work with their caregivers and their family members with the ultimate goal of returning home and into the community. Burke has a holistic approach to assessing patients' needs. And depending on the patient's unique situation, their diagnosis, and their functional recovery, their stay at Burke will vary depending on that. Some patients stay a week to 10 days. Other patients may stay as long as 2 to 3 weeks. Understanding the different options of post-acute care can oftentimes be very, very confusing. Hospital-based rehabilitation care is just that. It is care provided at a hospital environment. That means we have 24-hour physician coverage who leads an interdisciplinary team of rehab professionals that include nurses, therapists, social workers, and a whole array of clinical experts that specialize in the field of rehabilitation medicine. For patients who need an inpatient level of care, there are typically two options. There's acute rehabilitation and there's subacute. Acute rehabilitation offers a hospital-based level rehabilitation care with 3 hours of therapy, rehab nursing, and a full-time 24/7 physician and medical services. In the subacute option, that is a nursing home level of care. They have physicians, but they're oftentimes not 24/7. The rehabilitation care in a nursing home is provided based on what the patient needs, but generally speaking is limited to 1 or 1.5 hours per day. Over 50% of the patients who are cared for at Burke have some type of a neurological condition. A very common neurological condition that we care for is a patient after they've had a stroke. We also care for patients who've had a spinal injury, brain injuries, and other neurological conditions such as Guillain-Barré, multiple sclerosis, and Parkinson's disease. We also care for patients that have cardiac conditions, pulmonary conditions, and orthopedic conditions. And of course, we also care for those patients that have had amputations. The Burke difference is the recognition that we've achieved in U.S. News and World Report. We are one of the top rehab hospitals in the United States. Another important distinction that we have is that specifically in New York State, we admit the highest number of patients following stroke in the entire state. Another important achievement is that Burke has the lowest readmission rate in the entire United States. If you are a patient at Burke and are discharged home back to the community, you are likely to remain there. You have a very low likelihood of a readmission to the acute care hospital for a similar condition. Lastly, Burke offers a holistic, patient-centered, focused care. Our team includes rehab specialists, physicians who have the specialty of rehabilitation medicine. We have nurses who have dedicated their careers to the rehab goals of the patients. And we offer an array of therapy services: physical therapy, occupational therapy, and speech-language pathologists. The rehab specialists have care which is coordinated by our physicians, and they help to optimize the patient's medical stability and independence. And we strive to get the patients back to their community, back to the life that they want to live. At Burke, we have created the Marcel Caregiver Center. We recognize the important contribution of caregivers to the patient's recovery. And we dedicated a space and resources just for the patient caregivers. We include the patients and their caregivers in every step of their recovery process. We invite them to attend therapy sessions, and we invite them to participate in nursing care to ensure that the patients and their families have a successful transition to home.
Burke Rehabilitation provides every expertise for every life, from stroke, orthopedic and cardiopulmonary rehabilitation to traumatic brain injury.
Burke is a specialized hospital, and they have unique units for each of the patient populations that we serve. We have a unit devoted just to patients that have had a stroke. We have units for patients with brain injury, for spinal cord injury or spinal cord surgery. We have units for patients that have orthopedic needs and cardiac and pulmonary care needs, as well as patients with amputations. We actually have state-of-the-art equipment in each one of the therapy gyms to maximize the patient's active participation in the rehab process and help them to achieve their maximum level of independence. To determine appropriateness for a patient to come to Burke Rehab Hospital, we actually evaluate them while they're still in the acute care hospital. We have dedicated staff who review the medical records, discuss the patient's needs with the acute care team, and when possible, we actually visit the patient in the acute care hospital. Our goal is to hire experts in the field of rehabilitation medicine. We hire physicians that devote their careers to the care of the rehab patients. Our nurses are experts in rehab nursing. Our therapy staff is second to none. They have devoted their careers and their expertise in the unique specialties of physical, occupational, and speech-language pathologies. One of Burke's mission is to train the rehab specialist of the future. We offer a graduate medical education program for future physical medicine and rehab physicians. We also offer a robust nursing program and therapy program for physical, occupational, and speech therapists. To support the medical team of physicians, therapists, and nurses, we have additional services that include nutrition, dietary care. We offer social work and discharge planners to help our patients transition back to their home environment. We also have respiratory therapists and therapeutic recreation. For patients who transition home, they oftentimes need to continue their rehab journey in an outpatient setting. We offer a large number of outpatient services that have physical, occupational, and speech therapy close to your home. We are constantly looking at opportunities where we can bring innovation and expertise to the patients that we serve. We are excited to offer state-of-the-art services now, and we look to continue that journey into the future.